If you feel that free healthcare in Canada sucks, then you're not alone. You're going to want to watch this video.
Just want to let you know that we're also on Brighteon.com. You can find our channel there.
About 10 years ago, when I was still living in Canada, I had a really bad asthma attack. And I don't know if you have asthma or know anyone who has asthma, but you can't breathe. It's like you have a wet sponge over your face. And I had the asthma attack for several hours, and I decided I just couldn't get it under control, so I went to the emergency room. And when I went there, they told me it was going to be a 3 to 4 hour wait before a doctor would even see me. Now, I already couldn't breathe. And you kind of get in a sort of a panic state when you can't breathe. And I think the anxiety makes it even worse, makes the attack worse. So I said, okay, I can't wait several hours. So I went home. And what I did next shocked them all. I decided I'd call the ambulance. And the ambulance only cost me $40. And I think my health insurance at the time covered that. And the ambulance driver showed up. They gave me the nebulizer mask right away. I didn't have any trouble breathing after about 15 minutes. It was great. And we were on the way to the hospital. And we got to the hospital. They even gave me a second mask when we were in the hospital. I was in the gurney just in the hallway. I didn't get to see a doctor yet, but I already had 2 of the Ventolin masks, basically. It's like a Ventolin saline, and usually they put Atrovent in that solution. And I was already feeling much better. So by the time the doctor saw me, there was nothing left for the doctor to do. But when I told them I'd already been to the hospital and I went home and called the ambulance, they were furious. How else was I going to get any care? How else was I going to get a chance to breathe again? People die of asthma attacks. I think it's like 5,000 a year. People die of asthma attacks in Canada. I didn't want to be a statistic. So that was my story. But I got more. So when I had my C-section with Annika, it was a planned C-section because I'd had a C-section with Willem. I was in the hospital. It was a Thursday. I got released on the Friday because I said, what is the least amount of time I need to be in this hospital before I can go back home? And they said 24 hours. And it was about 26 hours. We were out on the Friday, and they said at 3 days you can go get your staples removed. And this was the week before Easter. I didn't want to be, in the hospital all these days before Easter. I had friends and family coming for Easter and a new baby. So and we were foster parents at the time. We had 2 foster kids. So we had a pretty busy household. We had a friend living with us with a daughter as well. We basically had 6 kids under 5 years old and 3 adults living in the house full time. Plus my mom and dad and my aunt were coming for Easter. So I didn't want to be in the hospital. However, that's not quite what happened. So on the Monday, I went to my doctor. When I left the Ottawa hospital, they gave me a staple remover to take to my family doctor so that she could remove the staples. So she removed the staples, and that was fine. That was the Monday, and a couple hours later, I went home, and I was in the washroom, and I went to wipe, and I realized there was blood everywhere, and I thought, oh my gosh, I'm bleeding. It's like a hemorrhage or something. So I looked, and the whole incision had opened up where the staples were. Now, they didn't tell me at the time. I could have left them in for 10 days. That's good to know. If you have a C-section, leave your staples in as long as possible. So we rushed out to the Smiths Falls Hospital, and we get there, and they tell us, oh, well, we didn't do the operation, so we can't deal with your gaping wound. You need to go to the Ottawa hospital where you had the operation, and they'll deal with it. That's crazy. You're a hospital. There are doctors. I have a gaping wound here. Like the whole incision opened up, and I didn't know how deep that went. Took the baby, went to the Ottawa hospital. They admitted us, of course, right away. And at this time, they said, well, we need to provide you with home care because we don't actually stitch you back up. Ironically, once you've been opened back up, all the bacteria from the air can get in, so they don't close you back up, even though they could somehow, I don't know if they actually could sanitize it. To be honest, it's probably a good thing. What happened was during the C-section, I wasn't in labor, so they were like poking and prodding to get her out, and they left this huge hematoma on my abdomen. So it looked like a gigantic bruise, and it was all that blood that was in the bruise that actually came out. So it was actually probably a good thing because I'm told later on that that could have actually caused an infection. So it probably was a good thing that I had it happen. However, I spent 2 nights in the hospital, me not wanting to be in the hospital that long at all. And I spent 2 nights in the hospital because they were arranging home care that I'd be doing at home. So that was my second experience with some sketchy healthcare in Canada. Now, in October 2022, I had been getting sick. I thought because my family had a cold or something. We didn't do COVID tests, so who knows what that was. But I was getting sick and it was affecting my breathing. Again, with my asthma, I'm like the professional here knowing when I can and cannot breathe. I mean, it is my body after all. I called my doctor up and I told her, I think I'm going to need something like a steroid, like prednisone, because my breathing is getting rough and I can't control it with my inhalers. Now, in case any of you don't have asthma, this is a nebulizer. And I had one of these at home. It has like a tube that goes from here to here and a little switch. Turn it on, you put your medicine in the cup and you put it on, you breathe. And this is how I deal with my asthma when it's completely out of control and I cannot use my regular emergency inhaler to get the asthma under control. So back in 2018, I had pneumonia and I had leftover medicine for my nebulizer. So I was using that Tuesday, Wednesday, and by Thursday, I had called my doctor for the second time saying, I think I need prednisone. And she thought she'd sent it into the pharmacy or something. I don't know what happened there, but by Thursday, I started the prednisone. So I was on the prednisone from Thursday, Friday, Saturday, and it's Sunday now, and I still cannot get this asthma under control. And not just that. I got my husband to go out and get me one of these O2 stat monitors. They're great. You put your finger in there, and it tells you what your pulse is and what your oxygen levels are. And as you can see, it's 96, although my heart rate's kind of high. Intriguing. Yeah, 96. That's normal, right? That is a normal reading. And I had this actually around my neck because by Sunday I could not breathe. And I could not get this thing over 90. It was 85 to 87 range. So I had it around my neck because it has a rope. And my husband took me to Smiths Falls Hospital yet again for an emergency because now I can't breathe. And if you remember what was happening back in the October 2022 timeframe, everyone was mask Nazis at the hospitals. Now, my husband had to wheel me in a wheelchair because I couldn't do the walking. I was completely breathless. So they asked who the patient was, him or me, me being in the wheelchair. And well, he said he was a little out of breath, but you know, I was actually the patient. And they gave me the mask and I said, I can't wear a mask. I can barely breathe as it is. And well, maybe I said it more in a, I can barely breathe as it is, you know, kind of phrase. But anyway, I took the mask because I was coughing a lot, trying to clear my airways. So I had the mask, you know, over my face while I coughed. But she said because I couldn't wear the mask, I had to go around the corner from the waiting area to not be with the people. You know, I'm completely like a leper here. So when that happened, my husband, he took the mask too, but he wasn't wearing the mask either because he was trying to catch his breath from after wheeling me in. And then a nurse walks by and sees us without mask. And she said, who was the patient? And, you know, it pointed to me. She said, well, you need to wear the mask or you need to leave. These people were complete mask Nazis. So he put his mask on like a good little citizen. And then the triage nurse comes out. Now, I'm coughing like this, sitting in the wheelchair, coughing, and she's trying to put the loops of the mask over my ears. And I'm starting to freak out in panic mode. I had the O2 stat monitor. I have been doing the readings. They were like 85. And I had an EMT friend who actually is the one who encouraged me to go to the hospital in the first place at that time because when I couldn't get the readings above 90, he said it's very dangerous. So here I am already struggling to breathe and she's trying to cover up my, you know, mouth with a disgusting mask I've been coughing into. And then she said, well, if you don't wear a mask, I'm not going to triage you. And I was completely floored. And I don't know if you've ever been in the hospital, especially when you have a loved one with you that's your advocate, and because you're not in the really right mindset to deal with disagreements with the medical staff. So anyway, I just had a bit of a meltdown, and you know, this is sort of out of character for me, but I said to her, what the f is wrong with you people? You know, that's not really how I normally talk. Well, I try not to anyway. It's not really me. And I was really, really upset. I left there crying. And this is Sunday. So he wheels me back out to the car, and I'm thinking, I don't know what to do. So my EMT friend tells us, instead of going to the Smiths Falls Hospital, try the Perth Hospital. They're both about, Smiths Falls is about 5 kilometers from us, 20 kilometers to Perth Hospital, so it's not that far. By Monday, I'm like, okay, I can't do it anymore. We really got to go back to a hospital. So I go to the Perth Hospital, and I walked in. I don't think we didn't do the wheelchair this time because it was really close to the parking area. So I walked in. The guy tries to give me a mask again. I said, I can't breathe. I can't wear the mask. He said, okay. Wow. Like a human being. That's so rare. So I went and sat in the waiting room. There was almost nobody there, which was, great because I got seen almost immediately. Immediately, she takes me to triage. She does my O2 stats. At this time, she sees that I'm in the mid 80s. And within a couple of minutes of taking some history, I'm in a treatment room on 2 liters of oxygen. I think I was in there for maybe half an hour or more before the doctor actually come to see us. And I believe they'd also give me a nebulizer mask at the same time to try to get some of my breathing under control for the asthma part. Well, when he came in, he was talking to me. He sent me for x-rays. I did the x-rays and came back. It's double pneumonia. I got pneumonia in both lungs. And he said when he came back after seeing the results, he told me, you have double pneumonia and you're only like 48 years old at the time. And he'd said, you look healthy and, you're talking to me and everything. And I normally wouldn't think you would have to stay in the hospital. But as we're talking, which is when you're breathing and using more oxygen, I couldn't get my O2 over 90. And he said, you're going to have to stay here. And he put me in ICU. And I was in ICU for a week. I went to the Smiths Falls Hospital the day before. They rejected me, kicked me out basically because I wouldn't wear the stupid mask for the mask Nazi. And here I am in ICU for an entire week. And that doctor was really good because he had said he couldn't believe what happened in Smiths Falls. And he said there's been some issues there and there's like a new enforcer in town. And he was going to actually handle it, because I was going to do like a complaint and do all this stuff. He said, well, if you want, leave it with me and I'll deal with it. So yeah, that was my experience with the medical care in Canada. I am not alone with this medical care problem in Canada. I did a little research and it doesn't take a lot to find it through Twitter or even YouTube videos. And here are some of the statistics on what's going on in Canada right now with the healthcare system. It is really atrocious. So here's a report I was reading. And it said that the MAID, which is Medical Assistance in Dying in Canada, the MAID program deaths were 4.1% of all the deaths in Canada back in 2022. That's 4.1% of all deaths in Canada are done by the government. And then I went on Twitter and I found some interesting reports here. And it says from this Sean Newman podcast, once again, what is this about? You guessed it, money. Studies show that MAID saves the Canadian healthcare system up to $130 million with an M dollars a year. So it's cheaper for them to kill you than it is for them to treat you, right? And he has a couple other things. He has track 1 is the terminal illness, deaths around the corner. Track 2, you're young, maybe you're depressed or anxious, maybe chronic illness, but definitely not dying. Now you can get MAID too. And we've seen this happen. They actually are sort of promoting it for kids with autism to basically be killed by the government instead of actually getting treatment or being given some sort of assistance to live an autonomous life, which is so horrifying since my son has autism. Really horrifying. Ian Miles, here he writes about the U.S. healthcare isn't perfect, but Canada's healthcare system is so bad that they're prescribing MAID to get people whose wait times are too long for them to receive their adequate care, and yet Trudeau's encouraging the U.S. to adopt the same failed system. So the wait times are too long for you to get care. Why don't you just kill yourself? The government is right here to help you, and there's no wait time for the killing program. There's another one here from Dennis Michael Lynch. The truth about healthcare. I pay $3,300 a month for insurance, yet I still have to pay out of pocket for appointments and tests. Canada's free healthcare system is no better, with hidden costs, sky-high taxes, and 8-hour wait times. And when I went to the hospital with my asthma attack 20 years ago, actually, the wait times were 3 to 4 hours then. They never got better. They only got longer. And 8 hours seems about right. We have some statistics here that talk about how Canada ranks among the world in their healthcare. And this is a table from the Moyer and Brana report comparing performance of universal healthcare countries in 2023. So it's pretty recent. Canada is here. The ranking is, out of 10, and Canada is almost at the worst for the able to make an appointment on the same day when you're sick. That's 9. Yeah, you'd never get that. Even if you have a family doctor, you're very unlikely to get an appointment with your family doctor within a week or 2 from when you actually want the appointment. That's what's really crazy about this whole thing. And then there you're somewhat easy to find care after hours. So that's always the emergency. You're never going to get, unless there's a 24-hour clinic in your city. Where we were in Smiths Falls, there was nothing that I know of that was open 24 hours except the ER. So that's 8 out of 10 on that one. Waited less than 4 weeks for an appointment with a specialist. Oh, that's impossible. So when I left the hospital in October 2022, one of the things they commented on was that I probably should have a sleep study done. And they took all my information. I was waiting for this appointment. So I was cleaning up my email in August or something, and I came across an email that was sent by the sleep place in April. I didn't even see it. It got buried in my email. Nobody called. So from October, I was supposed to write to them in April to get, give them my history or something and to get the appointment for whenever that was going to be afterwards. And I did fill out the stuff after, and I sent it in. They wrote me back, we don't have a referral for you. I'm like, well, yeah, because it was from April. They're like, oh, well, we threw that out. So you have to start over again. I'm like, yeah, that's not worth it. We're leaving the country. Forget that. We're gone. And the other one here is found cost barrier to access in the past year. And they have 7 out of 10 on that one. I got a couple more graphs here. One is physicians per the population. Canada is like way, 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 way down here. Very low. Japan, I guess, is lower. But, per 1,000 population, we have very few physicians in Canada. And we all know what happened to a lot of the physicians in Canada after the rollout of certain products, we'll say. A lot of them died, unfortunately. Now, hospital beds in Canada, that's another thing, right? Maybe you're in the hospital, but you're in the hallway, because I hear that all the time. My friend, actually, my old coworker, she had said she took her son one time to the hospital in Toronto, and they were in I don't know how long they were in the hallway. So hospital beds in Canada increased to 2.5 per 1,000 people in 2021 from 2.55 per 1,000 people in 2020. But hospital beds in Canada averaged 4.53 per 1,000 from 1976 until 2021. So what happened after 2021? It's like, they went from 4.53 and now they're down to 2.58. Okay, that's just crazy. What's going on here? We have people in Canada that need hospital beds, and we can't get them. Another thing here, PragerU, is how healthcare in Canada is working. Well, in Ontario, the country's largest province, that's where we were, the cost of nationalized healthcare took 46% of its entire budget in 2010. It says by the year 2030, that number is projected to be 80%. I know the number is actually quite high right now. So they said 46%. I'm not sure the exact statistics, but getting close to 80 in 2030 is totally on target, because the government's spending so much money on healthcare. And where is it going? It's not to beds. It's not to doctors. All I can think of is to the administration. How many Canadians have nightmares about getting sick in Canada? Want to hear a Canadian healthcare horror story? An accountant at my brother's company was coughing up blood. That's not something you do every day. She went to emergency in Medicine Hat, that's in Alberta, and they sent her home. And later that night, she went back to the hospital emergency at midnight and did not get care until 6 a.m. and then finally got a room at 9 a.m. She died shortly after getting the room. Awful, awful. And there are comments to this post, which is heartbreaking. And one of the first comments, just took my wife in for surgery. We made the appointment 2 years ago. So he says, the most Canadians say our healthcare system is why we shouldn't join the USA. Well, at least if you pay, you get help. That's the thing. If you pay, you get help. Healthcare is not free. You pay for it in your taxes. It isn't free. There's nothing free about it. Comment, I heard a similar story. Numerous trips to the hospital is incredibly wrong. Really have to stand your ground and demand more. If there is a situation like this, hopefully a family member is there to advocate and demand more care or tests. And that's what I'm talking about. If I wouldn't have had my husband with me to go to the hospital the 2 times I did go to the hospital in 2022, I don't think I could have stood up on my own to go after these people, because you're sick. You don't feel yourself. You don't feel the strength even to fight a fight. To fight over, I can't wear a mask. I just can't wear a mask because I can't breathe. You can see from my oxygen on the meter I have around my neck, I can't breathe. Why are you trying to force this on me? This is absolutely ridiculous. They're more concerned about a mask than my health. And I was in the ICU for a week after that. I'm lucky I survived. Not everyone's that lucky. If you want to know some of the other reasons why we left Canada, watch the next video.
Don't forget to hit the like button.